Best Meds for OCD. I'm Dr. Paul Looney. I am a psychiatrist. I've been in practice for 4 decades, and I really love seeing people gain freedom in their life to engage more fully and more effectively. Obsessive compulsive disorder can be very damaging to a person's life. It can require hours daily warding off obsessive thoughts or dealing with compulsive behaviors. And in those cases, while therapies can be helpful, medication can be transformational. My particular go to with obsessive compulsive disorder is Prozac. The generic in the United States, or the generics that are manufactured, are typically about half as effective as the brand name. In the United States, the brand name Prozac, made by Eli Lilly, is extremely expensive, to the tune of $300 or $400 a month for 30 20 milligram pills. So it's outrageously expensive. So I would recommend the generic at a rate of anywhere from 20 to 100 milligrams. You could even go a little higher than that. Typically, OCD responds to higher doses than are needed for anxiety or depression. I also find that OCD patients tend to suffer less with side effects from Prozac and other SSRIs because the target in the mind is different, and it tends to be extremely valuable. If you have the opportunity to order your medication out of the country, the brand name Prozac is quite superior, both in terms of effectiveness and lower risk of side effects. It's made by Eli Lilly, but in the United States, the cost is prohibitive, to the tune of $300 or $400 a month, versus ordering it off from the internet, from Turkey, UK, Australia, or other places where it's just maybe 40 to 60 cents a pill. So vastly different, but very effective. Buspirone added to Prozac can also help decrease the anxiety that goes along with OCD and can be very helpful as well. Buspirone is an anti-anxiety medicine that I have a video about. You start at a low dose and gradually build up to get the full benefit. In addition, some sufferers with OCD will do well with a bit of Seroquel. It's an atypical antipsychotic that has a calming effect. It can help with sleep and also reducing the urgency of those compulsive behaviors or obsessive thoughts that are so problematic for OCD. If you're a sufferer, I have great compassion for you because OCD can be very painful. Now, for some people, it just shows up when they're in a mood slump, when they're a little depressed, and when they get better, the OCD tends to get better. For some people, it kind of goes in a cyclic fashion where it'll kick in and then back off. But some people who I've worked with can tell me even as early as they can remember that they were very obsessive about their thinking, very compulsive about how they organize things and how they related to the world. So if you have this condition, I hope that this little video will give you some guidance in terms of what I've found to be effective in terms of medication strategies. There's a great book called The Imp of the Mind by Lee Baer, and it's excellent for those of you who are struggling with obsessive thoughts. Because I work with believers, a lot of people who have OCD struggle with something called scrupulosity, where they're overly concerned about having told a lie or committed the unpardonable sin or been blasphemous in some way. And that can be so painful. Other people just obsess endlessly about whether or not they're a Christian or going to hell. The Imp of the Mind is excellent in helping in that regard. There are also some therapists out there who specialize in working with people with OCD and helping you to gain freedom and control. And it's often debilitating and long-term illness. Hope this little video has been helpful. If so, please like it. Feel free to comment or ask a question. And if you would, please subscribe to my channel. I'm Dr. Paul Looney. I love to help people live happier and healthier lives. I love you.